Are you or a loved one dealing with osteoporosis? Actonel may be the solution you need. In this video, we will dive deep into Actonel 101, giving you everything you need to know about this osteoporosis medication. What is Actonel? Actonel is a prescription drug that belongs to a class of medications called bisphosphonates. It is primarily used to treat osteoporosis, a condition characterized by weak and brittle bones. Osteoporosis is more common in postmenopausal women due to hormonal changes that occur after menopause. However, it can also affect men and younger individuals with certain risk factors. How does Actonel work? Actonel works by inhibiting the activity of cells called osteoclasts, which are responsible for breaking down old bone tissue. By slowing down the rate of bone breakdown, Actonel helps to maintain bone density and reduce the risk of fractures. It does this by binding to the bone surface and preventing the osteoclasts from being able to break down the bone. The active ingredient in Actonel is called risedronate sodium. This medication is available in tablet form and is typically taken orally once a week. Actonel is not meant to be chewed, crushed, or sucked, as this can interfere with its absorption. Who should take Actonel? Actonel is primarily prescribed for individuals who have been diagnosed with osteoporosis. It is particularly beneficial for postmenopausal women who are at a higher risk of developing the condition. It can also be prescribed for men with osteoporosis or individuals with Paget's disease of bone, a condition characterized by abnormal bone growth. If you have been diagnosed with osteoporosis or have a high risk of developing it, your healthcare provider may recommend Actonel as part of your treatment plan. It is important to discuss your medical history, current medications, and any other underlying conditions with your doctor before starting Actonel. Benefits of Actonel for treating osteoporosis. Actonel offers several benefits for individuals dealing with osteoporosis. By slowing down bone loss, it helps to improve bone density and reduce the risk of fractures. This is especially important for postmenopausal women who are at a higher risk of experiencing bone fractures due to the decrease in estrogen levels. Studies have shown that Actonel can increase bone mineral density in the spine and hip, reducing the risk of vertebral and non-vertebral fractures. It has also been found to be effective in maintaining bone mass and preventing bone loss in individuals with Paget's disease of bone. Additionally, Actonel is convenient to take, with a once-weekly dosing schedule. This can make it easier for individuals to comply with their medication regimen and ensure they receive the full benefits of treatment. Actonel dosage and administration. Actonel is available in tablet form, and the recommended dosage and administration instructions may vary depending on the condition being treated. It is important to follow your doctor's instructions and the dosing information provided with the medication. For the treatment of osteoporosis, the typical dosage is 135 mg tablet taken orally once a week. It is recommended to take the tablet on the same day each week, preferably in the morning before breakfast, with a full glass of plain water. It is important not to lie down for at least 30 minutes after taking Actonel to prevent irritation of the esophagus. If you have been prescribed Actonel for Paget's disease of bone, the recommended dosage may differ. Your doctor will determine the appropriate dose and duration of treatment based on your specific condition. Potential side effects of Actonel. As with any medication, Actonel may cause side effects in some individuals. Common side effects include stomach pain, diarrhea, nausea, and muscle or joint pain. These side effects are usually mild and temporary, and they often improve as your body adjusts to the medication. Rare but serious side effects may include severe bone, joint, or muscle pain, jaw problems, such as jawbone decay or delayed healing after dental procedures, and unusual thigh bone fractures. If you experience any of these symptoms, it is important to consult your healthcare provider immediately. It is also worth noting that Actonel can interact with certain medications, including calcium supplements, antacids, and nonsteroidal anti-inflammatory drugs, NSAIDs. Be sure to inform your doctor of all the medications you are taking to avoid any potential interactions. Precautions and contraindications for taking Actonel. Before starting Actonel, it is important to discuss any underlying medical conditions or allergies you may have with your healthcare provider. Actonel may not be suitable for individuals with certain conditions, such as low blood calcium levels, severe kidney problems, or disorders of the esophagus. It is also important to inform your doctor if you are pregnant, planning to become pregnant, or breastfeeding, as the safety of Actonel during pregnancy or breastfeeding has not been established. In addition, Actonel should be used with caution in individuals with a history of gastrointestinal disorders, such as ulcers or difficulty swallowing. It is important to follow the administration instructions carefully to minimize the risk of irritation to the esophagus. Frequently asked questions about Actonel. What is the difference between Actonel and other bisphosphonates? Actonel is a bisphosphonate medication, similar to other drugs in its class such as alendronate and ibandronate. The main difference lies in the dosing schedule and the specific formulation of the medication. Your doctor will determine which bisphosphonate is most suitable for your condition. Can Actonel be taken with other medications? Actonel can interact with certain medications, so it is important to inform your doctor of all the medications you are taking. This includes prescription medications, over-the-counter drugs, and herbal supplements. How long should Actonel be taken? The duration of Actonel treatment will depend on your individual condition and your doctor's recommendations. It is important to follow your doctor's instructions and continue taking Actonel as prescribed, even if you start feeling better. Alternatives to Actonel for treating osteoporosis. While Actonel is a widely used medication for treating osteoporosis, there are other alternatives available. Some common alternatives include alendronate, ibandronate, and zoledronic acid. These medications work in a similar way to Actonel, slowing down bone loss and improving bone density. Your healthcare provider will evaluate your specific condition, medical history, and preferences to determine the most suitable treatment option for you. It is important to discuss the benefits and potential side effects of each medication to make an informed decision. Conclusion: Actonel is a prescription medication that plays a crucial role in the treatment of osteoporosis. By slowing down bone loss and improving bone density, it helps to reduce the risk of fractures and improve overall bone health. Actonel offers convenience with its once-weekly dosing schedule and has been proven effective in clinical studies. However, it is important to remember that Actonel may not be suitable for everyone. It is essential to discuss your medical history, current medications, and any underlying conditions with your healthcare provider before starting Actonel. They will be able to evaluate your specific needs and recommend the most appropriate treatment option for you. If you or a loved one is dealing with osteoporosis, Actonel may be a valuable addition to your treatment plan. Remember to follow your doctor's instructions, stay consistent with your medication regimen, and communicate any concerns or side effects with your healthcare provider. With the right treatment and care, you can effectively manage osteoporosis and improve your quality of life. Thanks for watching.